Hi everyone, and welcome back to Occupational Odyssey. My name is Kayla, an OT in the making, and today we are going to be talking about sternal precautions, what they are, how to move safely through daily activities after open heart surgery. So without further ado, let's get into it. What are sternal precautions? Well, these are going to be guidelines to protect your breastbone, also known as your sternum, aka sternal precautions, as it heals after surgery. The sternal precautions will last about 6 to 8 weeks, and the focus is to avoid strain, to avoid pulling, and to avoid heavy pressure on your chest. So the main rules of sternal precautions is that you are not to lift over 5 to 10 pounds. You are to not push or pull with your arms. You are to avoid reaching both arms overhead or out front or to the side of your body at the same time. And you are also to hug a pillow when you are coughing and sneezing. The main precaution that I like to emphasize as a young OT in the making is to use pain as an indicator. This means that you are going to use pain as your body's red light. So when the red light turns on, when pain turns on, you are to stop and adjust. Your sternum is the boss right now, and if it complains, you need to change the plan or come up with a different approach. So what I would like to talk about is ADLs. ADLs, activities of daily living, are the bread and butter of my future occupation. OTs are rehab professionals who focus on everyday life, not just healing. We focus on strength, regaining strength, healing tissue. However, we also want to make sure that people can do the things that they have to do and the things that they want to do, the things that matter most to them. PTs may focus on movement quality, strength, endurance, and OTs will look at how these physical abilities, as well as cognition and emotion and emotional aspects, will translate into daily life. OTs are going to help you balance independence with safety, showing you a way to stay engaged in your routines without jeopardizing your healing. So this is something that you might come across in your healing journey. And I just wanted to go over a couple things that you'll do throughout your day and ways to stay safe throughout them. So the first activity of daily living, or ADL, I want to talk about is eating. My favorite thing to do personally. So when you are eating, you are to be sitting upright at a table. You are to keep your items close to avoid reaching further out for items or reaching across the table for items. Also, a big part of eating after having sternal precautions implemented in your life is to ask for help and to receive assistance for heavy dishes or pitchers that you might have to carry. These might exceed the weight limit, and for that reason, just recruiting someone for help is always a good choice. Showering. When you are showering, you can use a shower chair if needed. If not, no problem. The goal with showering is to avoid twisting your upper body to grab soaps or shampoos. You want to use your whole body instead. And you also want to keep everything in a easy to reach place, meaning you don't want things overhead, you don't want things too far out. You want to keep everything nice and close, so that might require setting up before showering. The next thing I want to talk about is sleeping. This is probably my second favorite thing to do. Sleeping, many people will find it easier to sleep on their back or to sleep in a recliner. I found that I've never had a heart surgery before, a heart operation. However, I have had surgery on my knee. And I found sleeping to be the most comfortable on my back as well. The first couple nights were a little tough with the pain. It was quite unbearable, but you'll get through it and you'll heal and it gets better slowly. The other thing I want to address with sleeping is the log roll technique, which is something your physician or medical doctor might have brought up to you when getting out of bed. So instead of pushing yourself out of bed with your arms, which is the typical way people get out of bed, you will not be able to do this if you have to follow sternal precautions. So the trick is to roll onto your side. You want to hug a pillow just to ensure that your arms are staying within the tube, which we'll get into, but just to make sure your arms are staying within the sternal precautions. And you're going to push up with your elbow and legs. Like I said, you are not to use your arms. Preparing food, we're going to talk about super quickly. Setting up the workplace ahead of time, like I said, the showering is going to be super effective. You want to use lightweight pots and pans and utensils just to avoid that exceeding that weight limit. And also a good trick I like is to slide items across tables. So instead of lifting things and bringing them to other counters, just slide them across. Driving. This is an IADL actually, and this is something that gives a lot of independence to certain people. And so either as a passenger or as a driver, it's really important for community mobility. So as a driver, typically you are restricted to driving until you are cleared by a medical doctor. As a passenger, a little trick is to use a seatbelt pillow. You can purchase them on Amazon, you can purchase them online, or maybe in a auto body store. And this will just contribute to comfort on your chest. Table and work hobbies. I'm a big knitter myself. I love to paint. I have my paints right here actually. So table and work activities, you want to make sure that you're keeping your utensils nice and lightweight and that they're also very close to you. So you're avoiding that reaching, same thing like when you're eating. You also want to take breaks to avoid straining your shoulders. For hair care and grooming, this is going to be the last ADL that we talked about. You want to keep your elbows close to your body and avoid lifting both arms overhead at the same time, which can be tricky, but we can always adapt and change. And like I said, we just want to, pay attention to pain. You can use dry shampoo as a way to modify or adapt your hair care routine. You can ask for assistance when styling, since some hairstyles require your arms to be above your head for more than a few minutes, and that might cause pain. And when you're brushing your teeth, a little trick is to bring your head close to the sink instead of leaning too far forward. So when it comes to ADLs and IADLs, there's a tube analogy that many OTs and PTs will implement and teach the clients, and I just kind of want to go over that super quick. So with the tube analogy, I want you to imagine that your arms are moving inside a big invisible tube in front of your body, okay? As long as you keep your arms within the tube, you're safe. Reaching too far out of the tube, behind you, or overhead will put stress and impact the healing of your sternum. This way, with the tube analogy, you're keeping movements small, you're keeping them centered, you're keeping them close to your body, and you'll be working within a safe bubble or tube. So these sternal precautions can feel limiting at first. I am fully aware that you may be functioning at a different level as you were before the surgery. However, they're all about protecting you. They're protecting your healing and your chest and making sure that you recover safely. OTs will help you adapt your daily routines while respectively respecting these precautions, while respectively following these precautions. If you find this video helpful, give it a thumbs up. Subscribe to my channel for more OT related content, and stay curious, stay kind, and take care. Thank you for watching.